Why are colonoscopies worthless? So I wrote about this in my book, Cancer and the New Biology of Water. There was a chapter called Should You Be Tested for Cancer or something like that. And I got this mostly from the information of a book by a guy named Gilbert Welch, who is an epidemiologist and family doctor, I believe, at Dartmouth in New Hampshire. And he spent years looking through all the studies that looked at screening for cancer. And just to be clear on what screening means you're fine and you go in to see if there's something wrong with you, i.e. you have cancer. And that's different than a diagnostic procedure, which would be like you're bleeding in your bowels. Hey, doc, why am I bleeding? The first one, screening, is there's nothing wrong with me. I'm 65 or 70 or 8 or whatever it is, and I need a colonoscopy. His conclusion was that none of these screening tests actually were shown by careful scientific analysis to either prolong people's lives or improve the quality of their life. None of them. And as far as I know, that's still the case. So we're talking about colonoscopies, mammograms, stool blood tests, all the rest of it. Anything where you're fine. In fact, I don't know that I know a typical medical procedure that done on healthy, normal people or people who have at least no complaints has ever been shown to improve outcomes. I could be wrong about that, but I don't think so. Including blood tests. I don't even know about taking people's blood pressure. Now, to a certain extent, that seems counterintuitive because after all, why wouldn't you want to catch colon cancer earlier so you can take it out or poison it or something and get it while it's small instead of waiting until it's all over your liver and etc. Or you could even say, well, you could even do natural things, change your diet, do urine fasts, whatever it is that you're going to do. So why wouldn't you want to know earlier? So that, of course, makes a certain amount of sense, but just because it makes sense doesn't mean it's true. So I have personally two theories as to why it's not true. The first one is because the tumor is not cancer, or is not the cancer. That's the way to say it. It could be a cancerous tumor. What I mean by that is cancer is a metabolic disease, which I've talked about many times. You're poisoned, you decide to collect the poison into a certain location to keep it out of poisoning everything about you. And so we call that a tumor. And so the tumor is the resolution or healing part. And so even though it's sometimes good to take out some garbage, which is essentially what surgery is doing, even that has a cost with the drugs and the trauma and all the rest of it. And anyways, the cancer, the illness is not the tumor. And so finding it early will predictably have no impact on the course of your life. So that's the first reason. The second reason is it teaches you in a subtle way to be afraid and trust doctors. And if there's anything that's bad for your health, it's trusting the medical profession and doctors in general. So what happens when you decide to get screened is you live in the mindset of fear and that somebody has to tell you whether you're okay or not. And I think that is a horrible and destructive mindset to live in. In fact, we should all take it on ourselves to just by ourselves and with loved ones have a sense of how we're doing. Now, I'm not saying that everybody can see a tumor or feel that something's wrong or not. But if we lived in a world where you couldn't bail out and get a test to tell you how you were doing, you would, by definition, decide to get better at doing that. And I can tell you that's what I've done. And so as far as I can tell, I wouldn't get any kind of screening test for anything. I'm going on what I can see and what people around me may be able to tell me about myself, about how I look or feel or whatever it is. And that's, I think, a much more empowered, sovereign approach to managing your health. And that's not even to say things like, mammograms are X-rays, so they cause ionizing damage to your tissues. Colonoscopies, I don't know what the percentage is, but some percentage they, actually get rid of a lot of the healthy bacteria in your colon. Sometimes they stick the tube through the wall of your colon, and they put all these sterilizing agents in to clean the colonoscopy tube. Of course, you've got to do that, but then they get into your colon and irritate the tissues. So there's a lot to be cautious about that.